At University at Buffalo, in the last 3 to 4 years, we did extensive research investigating the prevalence of CCSVI in patients with multiple sclerosis, healthy controls, and patients with other neurological diseases. Our findings over the last 3 years indicated that CCSVI is of higher prevalence in MS patients than in controls. It has also been proposed that CCSVI should be corrected by an endovascular procedure. The procedure consists in reopening the stenosed vein in the neck. In the last 2 to 3 years, more than 30,000 MS patients underwent correction for this stenosis.
Because of the discussions we had around this incredible promise of a wonderful treatment for multiple sclerosis, resulted in the discussions which eventually led to the PREMIS study. The whole idea or premise of the treatment was that you could go in and open up veins which drain blood from the brain and the spinal cord and make patients with multiple sclerosis better. And PREMIS was a pilot study because it was based on a premise. And what we wanted to do was separate 2 groups of patients, one that we treated by opening the veins up. In the other group, we did not open the veins, and we would not let the patients or their physicians or their investigators know which group was which. When we looked at these patients' disease activity, what we found there was rather surprising and unexpected, and quite to the opposite of what we had originally premised, which was increased disease activity in patients who were treated as compared to the other group. That was probably the most important finding of this trial. The reason I say that is that instead of showing benefit, this pilot study demonstrates potential harm. Now, this needs to be investigated further. This is not the end all. This is not the last word. This is the first word. It clearly leads us to a better design for future larger trials. It also cautions strongly against general acceptance of benefit of this invasive procedure in patients with MS. And so our recommendation to patients and to practitioners who have in earnest been seeking betterment for their disease and a cure for MS, they should instead consider enrolling in trials rather than undergoing these procedures.